Well, not a breaking news in the fight against the pandemic. Advisors with the CDC have just voted to recommend Pfizer's COVID-19 vaccine for children ages 5 to 11. If the CDC director signs off tonight, shots could start going into arms before the end of the week. Mayor de Blasio says the city will be ready to start vaccinating young kids 24 hours after CDC approval. The mayor says the city already has some of the 231,000 doses it ordered from Pfizer, with the remainder on the way. Schools, pediatricians, and pharmacies will also play a key role in the rollout of Pfizer's vaccine for young kids here in New York. Judah Goldberg shows us how local practices are getting ready.
It's very safe. It's very effective.
Allied Physicians Group in Plainview has their fridge packed in anticipation of administering hundreds of doses to patients ages 5 to 11, both in the office and at mass vaccination events in the coming weeks. The goal, to get as many kids in the age group vaccinated as quickly as possible.
The science is there. The studies have been done.
Dr. Brian Goldstein understands why some parents may be hesitant, but encourages them to believe in the science.
You're not injecting something into the body that it can't handle. You're not changing the DNA of a person.
Results from a Kaiser Family Foundation poll found 1 in 3 parents will permit their children in the 5 to 11 age group to be vaccinated immediately. 2/3 were either reluctant or opposed.
You have to weigh the risk of doing it, giving the vaccine, versus the risk of not doing it. And not doing it potentially leaves you exposed and vulnerable to COVID.
Younger children will receive 1/3 of the dose for those 12 and older, and it'll be stored in smaller vials to avoid confusion. Parents we spoke to are mixed on the idea.
Really on the fence. My inclination is to say yes, but with like a little reservation.
Just don't think it's a good idea.
I wouldn't give my kids the vaccine.
Probably yes. But now that I have grandkids, it's a little frightening.
According to the CDC, while younger children are far less likely to get severely sick from COVID-19, studies show they can be just as likely as adults to catch and spread the disease. Jody Goldberg, Fox 5 News.